And is it still your belief that there's not a correlation between these soaring drug prices and innovation?
First of all, let me just say, Mr. Doggett, my organization is in your district, so it's a pleasure to speak with you today. The short answer is yes. The line that you hear from the pharmaceutical industry, which is that we must charge more and more every year for the same drugs that we put on the market 12 years ago, or there'll be no innovation, is simply not true. We would never say that of any other sector. We would never tell Apple must charge $2,000 next year for an iPhone because otherwise there will be no innovation. We demand that their products get better and cheaper over time, not more expensive and identical over time. And we've done a lot of research to show that, in fact, almost all the innovation in the pharmaceutical industry comes from unprofitable startups that are spending a lot on R&D but don't yet have marketed products. And yes, those companies are backed by venture capitalists and other investors with the idea they'll be profitable someday. But what do we do with generic drugs? We say you make your money and then the drugs go off patent and then life goes on and you have to develop a new drug. And we need to learn that lesson and bring that more into biologic drugs. The big problem with the way we have drug pricing now is for what are called small molecules, traditional drugs, the system works reasonably well. But for those biologic drugs like Humira and cancer drugs, the monoclonal antibodies and other drugs engineered from living organisms, the system isn't the same as the Hatch-Waxman system for small molecules.